Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Otitis Media. What is otitis media? We know an ear has got three parts: external ear, middle ear, internal ear. On the right hand side, picture has been given. Note this picture, please. This is the inner structures of ear. This is the canal from outside, from pinna, that is umbrella of the ear. From pinna it comes this tube, and here is the tympanic membrane, then malleus, incus and stapes, middle ear, then this Eustachian canal which connects the middle ear. This is middle ear to the throat, and then this is internal ear. So this is normal middle ear, and this is otitis media, that is inflamed. The inflammation of the middle ear has occurred. Note this thing, the channel is fully blocked up, the bones are inflamed. So this is otitis media. Actually, otitis means otitis media. External otitis very rare, internal also rare. Media most common type of inflammation of ear. So here we are talking about inflammation of middle ear or otitis media. In fact, inflammation of internal ear is a rare phenomena, and the same for internal ear. The external ear rare phenomena, and the same for internal ear too occurs seldom. Thus, inflammation of ear mostly refers to middle ear inflammation or otitis media. How is middle ear made of? It is made of, already I have explained, tympanic membrane, three ossicles, malleus, incus, stapes, oval window, round window, and Eustachian tube. Now this window actually, the stapes bone is attached to the internal ear through two windows. One is oval, another is round window. And this is the picture of the tympanic membrane. Inflamed, not normal, it is inflamed tympanic membrane. Inflamed. What are the causes of otitis media? Catching cold. Microbial infections such as bacteria like Haemophilus, influenzae, Streptococcus pneumoniae, Moraxella, catarrhalis, etc. Viruses, etc. That is, this is bacteria, viruses. Illnesses from nose, throat. That is, illnesses from nose, throat can cause infection in middle ear too. Flu, allergy, tonsils, adenoids, same thing. All these things can cause otitis media. What are the sign symptoms of otitis media? Fever, pain, tenderness in ear, discharge of fluid or pus from ear, hard of hearing, trouble in sleep, irritability rather, difficulty in keeping balance of the body. You know, ear, mainly internal ear, keeps the balance, but when the middle ear is inflamed, some sort of balancing problem will be there also in the body. And on the right hand side is a picture. This is Haemophilus influenzae and this Streptococcus pneumoniae, the most common two bacteria that those causes otitis media. When to consult doctor in case of otitis media? Middle ear is in close proximity with the brain. If infection spreads to the brain from ear, serious problem may arise, especially in children. Even death may occur from meningitis. This is very common complexity of middle ear infection in case of children, meningitis. And I have seen in my own eyes cases of death from meningitis in babies. So in case of children, consult doctor as soon as possible. How to prevent otitis media? In suitable cases, breastfeeding babies. The breastfeeding of the babies means when the breastfeeding is done, the baby gets enough protection, immunity from her mother or her mother. So that is one sort of prevention for the breastfeed babies. Take care so that children do not fall into passive smoking. Passive smoking, you know, when some elders smoking in the room and children are present, they are getting this passive smoking. This is very dangerous for them. Administer children flu and pneumococcal vaccine. These two vaccines, though names are something different, but they give serious obstruction to this happening of this otitis media. That is, otitis media happens seldom if these vaccines are already administered in the children. Flu and pneumococcal vaccine. Get enough fruit, veggies rich in vitamin C. Vitamin C resists catching cold. So catching cold is one of the most important cause for otitis media. So vitamin C is a very good prevention food for prevention food. On the right hand side, two important vaccines which picture has been shown: pneumococcal and flu vaccines. The vaccines name something else, but these are very effective for otitis media. Discussion of homeo remedies. Aconite for otitis media. Disease strikes suddenly. This is the characteristic of aconite. Or used in the first stage of the disease. Fierce heat, thirst, restlessness, fear of death, worse in the afternoon and in cold. Give aconite 3x 1 hourly. Phytolacca for otitis media. Pain radiates from ear to throat. Worse in cold, at night in bed. That is, patients are restless and depressed. Give Phytolacca 30 3 hourly. Rastux for otitis media. Patients restless, move along. This movement is for their relief. Better feeling from hot compress, worse from cold. They are very absent-minded, cannot memorize anything. This is general characteristic of Rastux. If the patient is really of Rastux, he will be absent-minded and his memory power is very weak. Give Rastux 6 2 hourly. Mark salt for otitis media. Tongue is salivary yet heavy thirst. Pain more at night, sweats profusely, and trouble increases accordingly. So sweat is increased, problem is increased. Give mark salt 3 1 hourly. Arsenicum for otitis media. Patient restless, depressed, fear of death. Burning pain in ear, hot fomentation relieves. Arsenicum 30 4 hourly. Chamomilla for otitis media. Pain in the ear along with pain in the teeth. Go frantic, that is the patients, the casualties, the person affected, go frantic in pain, as if pricking, sensation as if pricking of needles, restless and sleepless. Due to pain, they used to raise hue and cry in the house, especially children, boys, etc. Give Chamomilla 6 3 hourly. Hypersal for otitis media. Trouble more in cold or when uncovered. Much suffering in the morning. Ear is so tender that it cannot be touched even. Give Hypersal 6 2 hourly. This hypersensitivity of Hypersal is always there. So pain that cannot be touched. Apis mellifica or male for otitis media. Pain in ear as if bee sting with burning. No thrust. Weep for silly reasons. That is the patient's weep for silly reasons. Drop things easily from hands. These are general characteristics of the person, not of the disease. Right-sided affection. Epismel is for right-sided affection. Give epismel 30 4 hourly. With this, the video ends. Thanks for listening and viewing. Got anything to say? Please add in the comment section. I would certainly attend.